Doctors this morning have new first-ever guidelines for prescribing powerful opioid painkillers. The Centers for Disease Control and Prevention wants doctors to back off giving the highly addictive drugs to patients with chronic pain. The director said over-prescribing these medications is a key driver of the country's drug overdose epidemic. Our Dr. Narula is with us. Tara, good morning.
Good morning, Nora.
Boy, this is a very important recommendation, isn't it?
It is. It's huge. It's the first time that the national governors really stepped in this way. And they basically put out 12 recommendations for primary care practitioners who treat chronic pain for longer than 3 months. Their recommendations highlight the fact that the preferred treatment should be non-opioid or non-pharmacologic. If you are going to give an opioid, you better make sure that the benefits in terms of pain and functional improvement outweigh the risks. You need to establish treatment goals with your patients. You need to discuss the risks and benefits at certain time intervals. Also, when you increase dosages, don't combine benzos with opioids and use the lowest effective dose, and also follow your patients in terms of their risk of getting addicted or dependent.
And what are some of the brand names for opioids so people would know, what they're prescribed those?
Percocet, Vicodin, morphine, codeine, oxycodone, OxyContin, Demerol.
All of those
Those are all the names that we've
all
all
the different
heard.
kinds.
As habit forming.
Exactly, yeah.
And we keep hearing that they could be as addictive as heroin.
Yeah,
so how did this become such a problem?
We have such a huge epidemic in this country. Over 200 million prescriptions were given out in 2014. 40 people die every day from opioid overdoses. 2 million people are dependent or abuse opioids. And I think Tom Frieden, the director of the CDC, really said it well when he said this is really the only medication that is used to treat a non-fatal condition that kills so many patients so frequently.
Why is that? Do you think people don't know how to take them? They're disregarding doctors' orders or not getting the orders?
It's a number of things that have contributed. In the 80s and 90s, there was a real big push in the medical community to treat pain. Yeah. And it was this feeling that we really weren't being aggressive enough about it. So doctors sort of went a little bit overboard. In addition, the drug companies then were marketing opioids as being safe, non-addictive, and really misleading the medical community in many ways. Combine that with the fact that doctors were being graded in terms of how well they were controlling pain and reimbursed. Doctors weren't being well trained on the addictive potential. And then opioids began to be given out for things like dental procedures, headaches, back pain, surgical procedures. And here we are with the mess we have today.
So if you're in pain,
if you're in pain, there are other options.
I just want to change the subject for a moment. At what point is it too close to birth to be on live television?
It's never too close, Charlie. I have faith in you. I'll walk
what, that he could deliver the baby?
Yes, yes.
Oh, okay. Now, Charlie, get the hot towels.
You have more faith than I do.
Just don't give me any opioids.
He's good at all things. I'll bet he could deliver that baby. So next time we see you, you'll be the mother of 2.
Yes, I will.
All right.
Yes, very exciting.
Good luck on Fridays
Thank
today.
you.
Yes.
Dr. Tara Narula, always good to see you.
Thank you.
Almost a St. Patrick's baby.
That's right.
Yes.